This is our presentation on over-the-counter pain medications by Jackson Benning, Josh Jacobs, and Natalie Boyer.
So, a short introduction on over the counter pain medications or OTCs. By definition, these are medications you can take for pain relief without a prescription from a doctor. The most common types of medications and the medications we're going to be talking about today are ibuprofen or Advil, acetaminophen or Tylenol, naproxen or Aleve, and aspirin.
Why are over-the-counter drugs available over the counter? These drugs can be found at almost any pharmacy and grocery store. There are around 80 different types of over-the-counter drugs that range from allergy medication to weight loss products to pain relievers. These drugs are over-the-counter because they are safer for people. This means that these drugs have fewer side effects and under normal circumstances won't harm you at all. But this doesn't mean that these drugs are completely safe. If these drugs interact with other drugs that are being taken or certain supplements, there can be adverse side effects. There can also be unwanted effects from the drugs during pregnancy.
Ibuprofen is one of the most common drugs taken in America. Ibuprofen is better known under the brand names Advil or Motrin. Ibuprofen is in a class of drugs known as nonsteroidal anti-inflammatory drugs, or NSAIDs. NSAIDs are used to treat pain, fever, and inflammation. NSAIDs work by inhibiting the activity of the cyclooxygenase, or COX enzymes. The COX enzymes are responsible for producing prostaglandins, which travel through the bloodstream and alert the brain of pain and trigger inflammation. Prostaglandins also work near the injury itself, causing swelling, increase of liquids in the region, and constant pain. By inhibiting the two types of COX enzymes, ibuprofen decreases the amount of prostaglandins produced and prevents them from reaching the brain. Possible side effects of ibuprofen include heartburn or stomach aches, and ibuprofen may increase risk of heart failure, liver failure, and kidney failure, but that is more common when taken with alcohol. Acetaminophen, also known as paracetamol, is another pain medication, which is usually used for pain and fever relief. Acetaminophen is better known under the brand name Tylenol. Acetaminophen is on the World Health Organization's list of essential medicines, the most effective and safe medicines needed in a health system. While acetaminophen does have various mechanisms that are similar to those of NSAIDs, it has relatively little anti-inflammatory action. Acetaminophen can relieve pain in mild arthritis, but it has no effect on the underlying inflammation, redness, or swelling of the joint. The mechanism of action for acetaminophen is not entirely understood. It has been proposed that the drug also inhibits the COX enzyme, just like NSAIDs, but it shows a much higher selectivity for the COX-2 enzyme. Because of this, acetaminophen does not prevent production of the pro-clotting thromboxanes. The only major side effect of acetaminophen is liver failure, but this is only in the case of acute overdose. The risk of overdose is, however, increased by consumption of alcohol.
So, aspirin, or also known as acetylsalicylic acid. So, aspirin is one of the most common types of over-the-counter pain medications with up to 120 billion pills consumed each year. It treats pain, fever, and inflammation, and it is especially useful in Kawasaki disease, pericarditis, and rheumatic fever. And usually it's taken at a low dose to treat mild pain. It can also prevent heart attacks, blood clots, and strokes with long-term use. So here I have an image of how the COX-2 inhibitors work. So like ibuprofen, aspirin is an NSAID, or a non-steroidal anti-inflammatory drug, the ones that Josh talked about. So it inhibits the COX-1 enzymes and modifies the COX-2 enzymes to decrease the amount of prostaglandins produced, and thereby decreasing the amount of swelling, liquid buildup, and constant pain. So in the image you can see the enzymes are these blocks producing the messages that send to the brain. And COX-2 inhibitors like aspirin and ibuprofen latch on and prevent those enzymes from producing more signals. So some negative side effects that come across from aspirin are stomach aches, stomach ulcers, and stomach bleeding. And also, as seen in the bottom two images in this picture, you can see that there's also contraction of the vessel walls for blood vessels, and this is because the enzymes work in the vessel walls, and if you block the enzymes from working, as seen over here, that can cause constriction, which can cause plaque buildup and possible leading to stroke. Some other negative side effects are related to consumption of alcohol and third term of pregnancy problems. So aspirin has also been used to treat inflammation in colon cancer. So colon cancer is caused by inflammation that leads to lesions and small non-cancerous benign bumps of cells called polyops, which are precursors to colon cancer. So a study was done that found that 25% reduction in colorectal cancer-related deaths and a 20% overall mortality reduction when patients took aspirin before and after diagnosis. So that's right here. So you can see the decrease in the mortality rate and the risk. In the blue line is with aspirin and the red is control. And then in the other graph, it also shows a similarity. Basically, the amount of cumulative survival is increased for people who used aspirin post and pre-diagnosis.
Naproxen. Naproxen, known as Aleve to most people, is a very common pain reliever. It mainly treats pain or inflammation caused by arthritis, tendinitis, bursitis, gout, and menstrual cramps. Naproxen works by targeting the hormones that cause inflammation and pain in the body. It targets the COX-1 and COX-2 enzymes and reversibly inhibits both of them. Thank you for watching our presentation.